Hello, cat and feline medicine lovers. Welcome to our Feline Perfect podcast. Here you will find news and essential information for the well-being of cats. Grab your headphones and relax for another episode.
Good evening, everyone. I'm Your Name, and welcome to our veterinary podcast. In today's episode, we'll delve deep into the world of feline hyperthyroidism, a common endocrine condition in older cats. We will cover the diagnosis, treatment options, and comorbidities that often accompany this disease. Hyperthyroidism is one of the most common endocrinopathies in geriatric cats. The annual incidence varies considerably in different parts of the world. Studies in the UK have shown an annual incidence of 7.4% in cats over 9 years old. Other studies have revealed a prevalence of 2.4% in all cats and 8.7% in cats over 10 years old. Research in Hong Kong indicated a prevalence of 3.93% in cats aged 10 years or older, while in Japan, the prevalence was around 8.9% in elderly cats. These data highlight the importance of being aware of this condition in our geriatric feline patients. Several factors can influence the development of hyperthyroidism. Breed seems to play a role, with some breeds such as Tonkinese, Abyssinian, British Shorthair, Burmese, Siamese, and Persian showing a reduced risk. In addition, environmental factors such as exposure to polybrominated diphenyl ethers, PBDEs, found in flame retardants in fabrics, plastics, and household products may be involved. Dietary factors such as iodine and selenium levels in canned foods have also been investigated, although causal evidence is still limited. The pathophysiology of hyperthyroidism involves the proliferation of thyrocytes, which can become hyperplastic over time due to thyroid disrupting factors. This proliferation can lead to the formation of a palpable goiter. As hyperplastic thyrocytes transform into adenomas within the thyroid gland, clinical hyperthyroidism typically manifests. In about 2% of cases, thyroid carcinoma may occur, which can be diagnosed at the time of hyperthyroidism diagnosis or months, years later. Common clinical signs of hyperthyroidism include weight loss, polyphagia, polydipsia, polyuria, sarcopenia, tachycardia, heart murmur, hyperactivity, and increased vocalization. Some cats may also experience gastrointestinal signs such as vomiting and diarrhea. In some cases, the signs may be subtle, with only slight weight loss or changes in muscle condition. A palpable goiter is an important physical finding to look for during the clinical exam. Diagnosis of hyperthyroidism is usually straightforward. It involves measuring total T4 thyroxine levels in serum. In most cases, cats with hyperthyroidism have elevated total T4 levels, along with clinical signs and a palpable goiter. It is recommended to perform a complete blood count and biochemical profile to assess other concurrent diseases. A urinalysis is also valuable for assessing urine concentrating ability and monitoring renal function. Blood pressure measurement is important, as some hyperthyroid cats may have hypertension. In doubtful cases, measurement of free T4, equilibrium dialysis, may be useful due to its high sensitivity, although it has lower specificity. Scintigraphy may be considered in rare cases or when ectopic tissue is suspected. There are several treatment options available for feline hyperthyroidism. Radioactive iodine, I-131, is considered the treatment of choice for many cases. I-131 is a non-invasive curative option. However, availability may be limited in some areas, and cost may be a barrier for some owners and some cats may not be suitable for the isolation required after treatment. Thyroidectomy, which is surgical removal of the affected thyroid gland, is another curative option. However, it requires anesthesia and may present complications such as hypoparathyroidism due to damage to the parathyroid glands. Thyroidectomy may not be appropriate for all cases, especially those with bilateral disease. Medical treatment with methimazole or carbimazole is a common and effective option for controlling hyperthyroidism. These drugs inhibit the production of thyroid hormones. They are available in various formulations, including liquids, tablets, and transdermal gels, allowing for precise dose titration. Regular monitoring is essential to ensure the correct dose and detect any side effects. Therapeutic diet, which is a diet restricted in iodine, is an option for controlling hyperthyroidism. However, palatability and adherence may be a challenge, especially in multi-cat households or cats with outdoor access.